No, when did the doctor ask her to get admitted in the hospital?
So third time she continued with the same prescription and she felt better. This could be due to the fact that when she felt better the previous time, maybe the pathogen was kind of dormant and the medicines acted on them. But then again the process repeated because the pathogen was getting activated. Yeah, more resistant. And the last time her immune system was too weak. So finally the doctors suggested for various tests and she was finally admitted for constant medication and she was free for maybe general medicines.
Okay.
So she needed to be admitted there. Alright. So he has to be the hospital.
Fair enough. That's it? Great. So what I'll do is I will jot down points from every team and then we go over each of those points because I'm sure there'll be overlaps. Right? Great. Thank you. Come. That team raise the hand first. Go next.
Take self-medication. So during that, what might have happened is when she took the medicines, for example, let's say she had fever. So maybe the fever symptom, the temperature, everything decreased when she took the medicine. It gave like a quick remedy. It was like a quick solution. But it didn't solve the underlying problem there. So that's when it came back the next day. So then she goes to the doctor. And the doctor obviously looks at her symptoms and based on the conditions around, maybe the viral or sometimes when we have chicken flu going around, they ask us to do those tests and everything. So based on that, he basically just used a trial and error method wherein he looked at her symptoms and sought out the most common problem that she could have and gave her medication for that. And obviously that didn't work. So after a few days, instead of going to the doctor, she just takes the medication on her own. And I think by then, the pathogen becomes a little resistant. The medicine was not, in the second case, the medicine was able to slow down the pathogen's work or the disease-causing pathogen's work. But by the third time, the pathogen was able to resist that particular drug and was able to overcome that and continue its action. And fourth time, obviously the test results, the doctor might not have been able to find the exact problem, but he found out something related to that, like particular decrease or increase in, let's say, hormone levels or something like that. Based on that, he might think that this might be the problem. So again, he tells to get admitted in the hospital and he tries different treatments for her. And the treatments can be based on...
Is that an assumption that the team has made? That the fourth time when she was admitted in the hospital, they were trying out different treatments because I didn't say which treatment. No, it's fine. I'm not saying you're wrong. I'm saying is that an assumption that you made?
That's what happens. Usually when you go to a doctor and if it's severe, he doesn't know exactly what's wrong with the person. It might not be correct. It might be wrong later. So he
Who doesn't agree with this? Please come and tell me why. Why do you think what she's saying is not right? Come here. Yeah.
Come inside.
Louder.
I don't agree because
Yeah. Go that way because. Yeah.
okay, because doctors don't try out on patients like that.
Not always.
Not always.
It's not like a texting. It's like, for example, let's take an organ, liver. Maybe it's a problem with the liver, but they don't exactly know what's the problem. So they're giving the basic medication to solve the liver problem. But they're not able to completely figure it out yet. So we try different ways of finding out the different methods to basically diagnose the problem. So you will try out different medicines too.
Okay, but you beg to differ. You are saying that that's not the case.
Yeah.
So let's hear her views. Why does she think that?
In the first instance, instead of taking Prozac, if she would have approached the doctor, then if the disease was not that severe at that time, he would have tried out and maybe this or maybe that. But she went second time and it was a little serious. So
Right.
obviously the doctor will know what it is.
Am I saying she went to the same doctor?
No,
because usually that can also be true, but
Anybody else in your team who wants to dispute Navya? Please come.
She told that in the first time she was being the doctor. If we go, I'm telling wait, let me complete it. Like whenever we have some fever, when we go to clinics or something, in the beginning they won't let us go for any tests or something. That is what my teammate meant. In the fourth time she went, she go to the tests. Tests not for the major one, like minor one, X-ray or scanning or something.
No, the tests were already done. And she was taken to the hospital.
Yeah, tests were done.
So her argument is on the basis that the tests were already done and she waited for a day or two when the reports came, and that's when the doctor said, you know what, this time it looks much more serious than your previous bout, and hence please come and get yourself vaccinated.
But even when she went to the second time or something, obviously when we consult a doctor, we consult the same doctor.
Not necessarily. So that's
Like whatever previous happened, it will be go to if you go to the other one, they have to explain everything like what happened.
who agrees now?
It's obvious that
Your team guys, Great. Fine, fair enough. See, you can have two schools of thought. Either you want to suffer through the pain going to the same doctor even if you're not getting well, or you're adventurous and you say, so be it, if it means I have to speak for 10 minutes extra and get to the right hands, I will do it. Right? So please do.
also.
Yeah. So Shweta has a point. Yeah, after that I'll come. Yeah.
You said the tests were done, but we are not sure the doctor knew what infection is.
Okay.
Exactly. That's why he wants to keep her under under surveillance, so that he can check at what stage, what is happening, how she is reacting to what. So that in a hospital is more convenient, because at home obviously all those facilities are not available. Let's say her disease has progressed to a stage where the disease has progressed to a stage where her immune system is completely shutting off. You obviously can't take care of that at home. So when she's in a hospital, it becomes more easier for a doctor to decide what is the best course to take in her case.
So who are you supporting?
Mine.
Of these three? You're supporting her.
That's what
she's
I'm
saying.
saying.
She said trial and error. I just have one point to make here. Whereas she's saying the treatment is very empirical. She says, you know, the doctor is probably going to give the patient drug A on one day, and then he might see if she's responding to drug A or not, and then he's going to decide whether he is going to give her drug B. That's what she's saying, right? Whereas what she's saying is, he's already made up his mind, looking at her reports, that, you know, fairly conclusive diagnosis has happened, and hence he pretty much knows that of these three drugs, I might use, you know, one of those.
Ma'am, but also, it's happened so many, it's taken such a long time for the disease to progress. The doctor has already given one set of medicines. So the doctor already knows, okay, that's not working. So he's
So I'm
sidelining
going to
that.
ask your team when your turn comes, why do you think that didn't work? So think through before your turn comes. You know, you have to tell me why it didn't work. So thank you. You know, we'll come to your turn. Thank you so much. Yeah. You have any other point to make? That's it? So now my question to your team is, I think you were the one who mentioned that the first time she didn't go to the doctor and she did self-medication. So now my question to you all is, as soon as you see a 99.3 degree, should you get scared and rush to a doctor and start yourself on some No? Anybody who disagrees?
You should try and look for other symptoms, which
Why
might not
should I try and look for other symptoms?
which are not
Which we are not used to it. Let's say I'm used to a backache, perpetual backache and, you know, cold and cough. Do you still think, you know I am prone to probably an upper respiratory tract infection in a city like Bangalore. Do I still need to get flustered and run to a physician every time when I see these symptoms?
When you go the first time itself, you will be knowing what are the medications, and you will be
you know the basic remedies you have to take since you know you have an infection.
Remedies is a word we will dig into. Okay.